Thank you for calling into Congressman Mark Walker's telephone town hall about the coronavirus outbreak. Congressman Mark Walker, Director Mike Sprayberry, and Dr. Erik Summers await your questions. This event will begin with some comments and questions between our hosts, and then it will open for question and answer. Please dial *3 if you would like to ask a question during this event. Congressman Walker, thank you very much for your leadership on this issue that is so important right now. We'll turn the call over to you.
Listen, I want to say thanks to everyone joining us over the phone today, and some may be viewing online. I first want to thank our North Carolina Director of Emergency Services, Mike Sprayberry. I can tell you that even on the federal level, North Carolina is recognized for their excellent work in emergency services and emergency preparation, and Mike Sprayberry is one of the best. Also on the line, we have Wake Forest Baptist Chief Medical Officer, Dr. Erik Summers, who's joining us today. Alongside of Director Sprayberry, we have Dr. Zach Moore, the Chief Epidemiologist there in Raleigh. And in our offices here in Greensboro, we have Mayor Nancy Vaughn, who may need to answer some questions that are directly related to the Greensboro area. Like you, I have seen many reports, sometimes with conflicting data, and that's why we wanted to host this teletown hall so that we can have an opportunity to hear from North Carolina's leading experts and for the general public to ask questions so that we can all be better prepared in taking care of our family. As of today, there are 5,000 positive cases of coronavirus in the United States. We believe there's around 50, as of this afternoon, cases in North Carolina. On March 6th, the federal government sent North Carolina $15 million, a little over $15 million, from the Coronavirus Preparedness and Response Supplemental Appropriations Act. We also passed out of that a total of $8.3 billion. Early Saturday morning, we passed additional legislation that would provide free testing for senior adults. It would provide nutritional supplement for children both in our urban and rural areas, along with some other details. If I have time, I may get into that this evening. But when we've got our experts on the line, I wanted to go ahead and turn things over to Director Sprayberry, who can give us an update on the state emergency response. And after that, I'll introduce Dr. Summers, and we can hear a little bit more from the medical side as well. Director Sprayberry.
Thank you so much, Congressman, and thank you it's an honor to be on this call. I'm going to be very quick because I know we want to get to Dr. Summers, and I know we want to get to the questions that so many people have. As you know, this event has spread very quickly. We call it COVID-19. I can tell you that since January, mid-January, we have activated the Public Health Coordinating Center where we were tracking this virus. We had a liaison from emergency management inside the coordinating center so that we could work together with our Office of Emergency Medical Services and our public health partners to make sure that we had a well-synchronized approach and were prepared for as the event grew. So that happened in mid-January. We kept tracking. In March, at the beginning of March, we opened up our Joint Information Center so that we could then begin to send out more messages in preparation for this event. On the 10th of March, as you know, the governor declared a state of emergency. We opened up the state EOC at that time, the Emergency Operations Center. We're still activated, and we're open 24 hours a day, 7 days a week at this point. We have our partners from folks like the National Guard, Public Health, Office of Emergency Medical Services, Department of Public Instruction, and other relevant state emergency response team partners. We're doing things like providing equipment and supplies to our healthcare coalitions and other partners who need them at the local level. We're also making sure that we are accurately counting bed space availability, because we know if this situation gets larger, as we expect it to do, we'll need to be closely understanding what the numbers of beds are in all of our healthcare facilities. We're also tracking our sample collections. It's what people call testing, to make sure that there's enough availability of testing out there for those folks who present symptoms. And then we're just basically working together. We're trying to, as they say, flatten the curve to slow the spread of the virus down so that it doesn't overwhelm our resources at one time. That's kind of what our little mantra has been over these days. And I can tell you, everybody that's out there, and Congressman, as an emergency manager, I continue to learn a lot, and I appreciate the opportunity to talk with your constituents tonight. That's what I have for you, sir.
Thank you, Director Sprayberry. We'll come back to you in just a few minutes with questions. I wanted to turn things over for just a couple of minutes or so to Dr. Erik Summers. Dr. Summers is the Chief Medical Officer at Wake Forest Baptist Medical Center. Dr. Summers, would you speak to us for just a few minutes?
Yes, thank you, Congressman Walker. And I second Mike's statement earlier about the honor of being able to talk with the community about this. Certainly there's a lot of information out there, a lot of things going on. My goal is to share with the people on this line the latest medical information with regards to COVID-19. I'll try to do it as simple as possible and easy to understand language, because I think that's important that you get the information that we know. We're going to hit the key points with regards to the things that you can do presently to minimize your risk of obtaining this virus. As Congressman Walker mentioned, we're up to 6,000 cases in the U.S. and 47 in North Carolina. Fortunately, no deaths in the state to this point, but we certainly have not overcome this issue yet. I can say from a community perspective, talking with my infectious disease colleagues here at Wake Forest, while there have been a few cases in the area, we have no obvious community transmission at present. In the future that may be different, but presently no community transmission. The cases that we're getting are associated with travel, et cetera. While things are changing day to day, and we're dealing with issues day to day at Wake Forest, I really, for the group, I would take this whole condition as more of a marathon as opposed to a sprint. The things that are going on are going to take a period of time to overcome. It's unknown if it's going to be weeks or months, but a big part of this will depend on how we respond as a community to this virus. While we don't have a vaccine or medication yet for treatment, we do have options to minimize risk. We have information from our colleagues in Italy and South Korea and China, and so we've learned from those countries about preventative measures. So at a certain point in this talk, I imagine I'll get to the key things that all of us should be doing to prevent obtaining this infection and preventing the spread. The condition, as compared when we look at other countries, there does seem to be elderly patients above 60 with medical conditions that tend to be most at risk. For that reason, we've talked a lot about this at Wake Forest, about having a cocoon of safety for those people, the most vulnerable population. That also includes patients that are immunosuppressed. But I also want to make the point that this is not just, even though I represent Wake Forest, this is much bigger than my institution. And so when I say we, I'm talking about Novant's efforts, Moses Cone, Atrium, UNC, Duke, East Carolina, all the major systems in our state. We are coming together and working together to beat this disease, and that's nice to see that we're all on the same team right now, because we want to protect the people in North Carolina. So I'll turn it back over to the Congressman, and I'm happy to answer any questions.
Thank you, Dr. Summers. Before I go to a couple of questions to Director Sprayberry, Dr. Moore, did you want to add anything to Dr. Summers, being that's your field as well?
No, I appreciate his comments, and I think it's important for everyone to keep in mind that This is a virus that we did not know existed just a few months ago. So all of us globally are learning more every day. It's important for us to always acknowledge there's still a lot of uncertainties, and we do learn by the day, sometimes by the hour. And so all the recommendations and guidance and everything we are trying to do to flatten the curve, as Director Sprayberry said, are based on the very best information we have, but all of it is subject to change and will change as we get new information. We want to make sure that we're, incorporating that into our plans and our thinking. And so what our strategy is right now is likely to continue to evolve as we learn more and as the situation changes.
Thank you very much. I'm going to start the question times here. I'm going to start with a couple that we've received, and then we'll start putting some people in the queue. Director Sprayberry, obviously there are unique challenges faced with this COVID-19 compared to other diseases and viruses. I don't know if you want to get into detail what those might be, and how do we plan to address these challenges?
Thank you, sir. And I have to say that first and foremost, we have dealt with, a pandemic before in 2009, H1N1. And so what happened there, though, is we did have medicine for that, and we were able to deploy that medicine to all counties and issue the medicine via points of dispensation. So big difference here. We don't have a vaccine. We don't have a pill. There's no medicine to take for it. So it really adds a whole different aspect to the virus, because it's hard for people to see real action taking place other than sample collections, and that's what people call testing. And so, that it's hard for people to understand, well, what are we doing? What is the team doing? And so, as everybody can tell by, they're in touch with media, you can see that, the federal government's trying very quickly to come up with some medicine. But I think the biggest thing right now is good communications, accurate communications, that we can let the public know what they need to be doing to maintain social distancing, to make sure that we're not in mass gatherings. And we're trying to do the same thing here at the State EOC. As you might imagine, it's pretty tight quarters here. So the folks that we have here that we can let go and work from home, we've already done that. And so yes, even in our press conferences, we distance ourselves on stage, we distance the reporters. So one of the big things is, since the disease is so widespread, typically you can call in resources from other places, but this is global. And so, and a lot of the items that are made for personal protective equipment are made in countries that really got hit hard by the pandemic, such as China. And so we know we've had shortages of personal protective equipment, and we've had shortages of testing, supplies and things like that. But I think gradually we're starting to overcome some of the issues in the supply chain. We're not there yet. We know that. And so this is going to be a process. It's going to be a timely process. And we've just got to virtually link arms together and move forward and put the right messaging out. And you heard today where the governor, no more restaurants and bars. The schools have been shut down. These are times that are unlike any that I've ever known, and I'm sure that anybody that is alive has ever known, maybe the Spanish pandemic. So that's kind of the things that we're dealing with, sir.
Director Sprayberry, you talked about communication, and this would be my final question for you before we get into a couple other ones. What are some of on the federal level, I know that people can go to cdc.gov. On the state level, are there any resources that you would suggest for somebody on this call or anyone that wants to stay updated on North Carolina's response to COVID-19?
Yes, sir. So I think it's NCDHHS.gov website, and there's even, if you go www.ncdhhs.gov/coronavirus.
Yes, sir.
I think that'll get you to everything that you need.
That's nc.d as in dog, hhs dot.
So,
What was the
so
rest of
I'm
it?
sorry, after NC, there's no dot. It's just ncdhhs.gov.
Got it. We got it. Thank you very much for helping us with that. Dr. Summers, what is the most common way the virus can be spread in households?
Thank you. Typically, the spread is via respiratory droplets, which means coughing or sneezing. You can also get it, COVID-19, by touching a surface that has the virus on it. And there's been some different things out there in the news about how long does the COVID virus stay, and how, and so some services will say, or some news organizations will say, oh, it can be for 3 days. But so far, we've only found through research that for 2 to 3 hours after someone touches the surface, can you pick up the virus? But respiratory is way more common. So that being said,
Go ahead.
I was going to say I was going to go into recommendations. The coronavirus is what we call a heavy virus, which means that it doesn't spray far distances. So we found that 6 feet is the appropriate distance between people to keep the spread of the coughing and the sneezing. So you want to stay a healthy distance. That's the social isolation, 6 feet. But beyond that, there are 3 big areas that you want to deal with when you're dealing with this condition. And the group may have heard of some of these, but I'm going to go a little bit deeper to give you some other things that you may not have heard of. First off, washing your hands, making sure your hands are washed, being obsessive about it. And washing hands, there's some detail to that. One is you need to wash for 20 seconds. We typically wash the palms of the hands, but don't forget about the back, the thumb, in between. So this is a little bit deeper washing. Some people say, what's the best thing to wash your hands with? It's from our perspective, it's soap and water. Hand sanitizer with greater than 60% alcohol would also be okay. The other thing that we all do is touching our mouth, nose, and eyes. And it's easy to say don't do that, but we all have done that over the years. And so just thinking about it and not touching those areas will also be important, because that's the way to spread the disease. Cleaning frequently touched surfaces, disinfectants. Obviously, if you have signs of fever or shortness of breath or cough, you should stay at home. Those are one piece of the recommendations, and I'll do this real quick. The other is, the social isolation. Avoid close contact with people who are sick. If you are sick and there is concern that you have COVID-19, you want to wear a mask. If you don't have concerns of infection, it's not recommended by CDC right now for you to walk around with a mask. You want to keep your distance. The other things of note, and this hasn't been talked about as much, is that the vulnerable population are older people, and especially older people with chronic medical conditions. So you want to be very on top of your medical conditions. Take your medicines as appropriate. If you have lung conditions like COPD or asthma, you want to be on top of your inhalers. This would not be the time to smoke. In Italy, there was an association between smoking and severe disease. So doing the right things, getting a lot of sleep, reducing your stress, and I know that's easy to say. I imagine some are stressed, but this is not something to panic about. It's just something, do these preventative measures. Keep your medical conditions under control. Wash your hands. Stay away from people, and you'll much reduce your risk.
Thank you, Dr. Summers. I think now we're going to go live to some of our questions here in the queue. I'm going to bring back in our Deputy Chief, Julie Emmons. who will be helping guide this portion of it as we move forward in fielding questions for Dr. Summers or maybe Dr. Moore. I'm here as well as Mayor Vaughn and Director Sprayberry. So, Julie, if you'll take it here for our first question.
Yes, we're going to start this evening with Diana from Greensboro. Diana, you have a question about the interactive map on COVID cases?
Yes. So one of the things that happened today was I heard, there were 50 cases, 47 cases, and on the map it says 40 cases, and I understand that that's going to be updated at 11 o'clock each day. But I was hoping you could talk a little bit more about it because there seems to be some discrepancy on the times, and maybe there's not, but does it include presumptive positive, which is, I think, a single positive test, as opposed to a positive, which is 2 positive tests? And then I have a couple of follow-up questions, if you don't mind.
We'll try to get to as many of those as we can. Director Sprayberry, would you like to take the first question?
Yes, sir. And what I've got our chief epidemiologist, Dr. Zach Moore, and I think that question will be perfect for him.
Yeah, thanks for the question. And a couple things. Yes, you're correct. So on our state website that Director Sprayberry gave earlier, we are updating once every day at 11 o'clock the case counts, and that is broken down by county. As far as the question about presumptive positive versus confirmed, that is no longer a meaningful distinction. When a new lab comes online with a test, like all of our state laboratories of public health across the country had to with this, for a time there's a confirmation required. In this case it was a CDC, but that time has passed. So tests are just now considered confirmed when they're confirmed either here, or we do have several hospital and commercial labs that are doing testing also. So you won't be seeing any presumptive or confirmed kind of language. It's just going to be case counts.
So would it be fair to say, Doctor, that any case that you see on that map is a confirmed case?
Yes, that's correct. That'll be our laboratory confirmed cases from any laboratory that's been approved to do this testing.
Thank you very much. We're going to go back to our Deputy Chief for our second question here. Diana, we appreciated the time that you wanted to follow up. We want to get as many callers as possible. We also have some information that you can contact us directly at walker.house.gov. You can send us an email there if by chance that you didn't get to follow up with some additional questions. Deputy Chief Emmons.
Okay, at this point we're going to hear from Pat, who is actually a healthcare administrator and has questions about encouraging young people.
Yes. Hello, this is Pat. Thank you, everybody, for what you're doing. And I just retired, and I completely understand what's at stake here, the stats, what exponential means. I'm seeing a lot of younger people, I'd say teens through maybe their mid-20s, who are just saying to me, well, I'm not going to get sick, so what's the big deal? And they're attending parties and such. Is there any thought to specifically reaching out to that demographic who just isn't getting this, unlike us who have been closer to the front line of disease? PSAs, things on YouTube, such as having youth who've lost a family member talk about the severity of this and how important it is to go by the recommendations. That's my question.
Director Sprayberry, did you want to address that at all?
Sure. So I can tell you that our communications team has a social media outreach plan to address the youth, millennials, and basically young folks who basically feel like, they're at low risk, and they may be at low risk. In fact, their symptoms may be very mild if they contract COVID-19, but the issue is not just that, is their ability to transfer the disease to other high-risk individuals. And so to that end, we do have a social media campaign ongoing to try to reach that part of our population. I know that we're doing it at the state level, and I know the federal government is also addressing it, not only in their social media, but also in their press conferences. And so, this is something that I think everybody needs to address and help us address because, we've seen folks, going out and still gathering in groups, large groups, and so it's a very important. Thank you for that question.
It's a very good question.
Thank you, Pat.
Thank you so much. Dr. Summers, take 30 seconds. We hear the term asymptomatic a good bit. Would you mind kind of breaking that down for us a little bit, specifically when we were just talking about young people? Can you talk about that?
Sure, I can talk a couple things about that. One, the definition of asymptomatic is a person that's showing no symptoms. Now, in this condition, can you have COVID-19 and be asymptomatic or show no symptoms? Yes, you can. And so you can have that at the beginning of the disease, and you can also have it at the end of the disease. You can still shed and give to other people. So what you want to do is, in terms of the symptoms of the disease, you can think you're better, but you could still pass it off. Now, the common symptoms that you see for people that have COVID-19 and where we get concerned is when patients with fever, cough, and difficulty breathing. Those are the big three. Now, while those symptoms are the classic symptoms right now of COVID-19, those are symptoms that you can see in just a standard virus and also with the flu. So those symptoms are broad. So then you may ask, well, when should I get tested for COVID-19 or not, or when should I talk with my doctor? And what we have been counseling our patients, is that if you're having really rapidly progressive symptoms with your lungs, if in the morning you're not breathing well and then by noon it's more severe, that's something where you need to talk to a doctor quickly or go to the emergency room. Certainly if you have signs of pneumonia or a real severe respiratory infection, you need to talk with your doctor or go to the emergency department. But we don't have specific symptoms for COVID-19, which makes it a little bit more difficult. But we want to be very careful, and we want to get to the bottom of this.
Thank you, Dr. Summers. Julie, would you have another question for us?
Absolutely. We have Sue from Archdale, who is over 65 and has a question about hospitals.
Okay. Sue, go ahead.
Question. The first thing I had was I had a family member who recently was this weekend or in the last week has been in the hospital with major problems, and we had to be at the hospital, and they were rationing masks and didn't have a lot of supplies there. I was really surprised that they didn't have them, but I know that a lot of people are taking things, and I was concerned about that because it's a critical situation. And not only that, but of course, us being in the grocery stores and places, you're not able to find a lot of hand sanitizer. Every time you hear about it, it's gone. Also, family members that may work in the restaurants that now are shutting down, I have a concern about what they're going to do because that's their job. Also, and this is just another part of all this together, it just came on as a special report that China's saying that we may not be able to get some of our medicines now, and a lot of us have health problems that are, they're severe, or they could be severe without the medicine, and those were some of the things, and they just came on with a thing, you were talking earlier about something staying on the surfaces. They also just mentioned stainless steel, the virus could stay on it for 3 days. This is on Fox News. So just to ask that question, what do you do when you have health problems, you can't get even some of the things, or you may not be able to get your medicine, or you may not get the things that they're saying to use, or you have family members you've got to be around because it's a matter of imperative that you have to be part of that situation. What do you do to get the things and also to keep them safe as well as yourself?
I think those are all good questions there. I'm going to briefly answer the last part of your question, and then I'm going to ask Director Sprayberry to talk about the personal protection equipment and some of the concerns there. As far as dealing with China right now, I can tell you, I serve on the Committee on Homeland Security. They don't have a great track record of telling us the truth in many instances. However, we're searching this every day. There's been no interruption as far as getting the antibiotics and other medications. Maybe you can make an argument that too much of that is made in China, and maybe that's something we can address in the future. But right now, there's been no issue getting the things that we've always got from China when it comes to our manufacturers. And we obviously will need to make some adjustments later on in the future. Director Sprayberry, can you talk about PPE for a little bit?
Yes, sir. And so she's right. There is a short of personal protective equipment, but the priority is going to healthcare workers and first responders in that order, and that's the way it ought to be. But I would say also that our state was uniquely positioned with equipment and supplies because we have a very strong healthcare coalition with 8 trauma hospitals, and they have caches of equipment and supplies that they've been able to push out to local health departments. And also they have been working with the normal supply chain to get more PPE in. We've been working a little bit outside of that, and we're able to get some more hand sanitizer, some more swabs for sample collecting and things like that. So I'm not going to sit here and tell you that the supply chain is full and we're getting everything that we need, but what we're able to do is we have basically filled more supply requests than we did for all of Hurricane Florence, which was our storm of record. And so but we are managing to fill the request without big gaps for healthcare workers and first responders. Although for some law enforcement folks, we'll give them a smaller amount than they requested, but with instructions of how to make it last longer. And so we got a shipment from the Strategic National Stockpile from the Health and Human Services last weekend, and that's been distributed to our healthcare coalitions as well. So I would say, ma'am, that it's a work in progress. It continues to be. It's a national problem, but we're managing to address it at this time.
Thank you, Sue, for that question. We'll have more to say on our website, as well as an additional town hall when it comes to the small businesses, specifically those who have employees with less than 500. I know many people are feeling the impact. My own daughter, who goes to school and works in Winston-Salem, sent me a screenshot of her being laid off today. And I think we need to continue to empathize and do everything that we can. We're looking at additional federal legislation even early next week as far as stimulus package that will go directly to the small businesses and other people impacted, and we'll have more to say on that in the days ahead. Julie, would you like to offer another question?
Sure. We have Mark from Bear Creek, who's a safety officer at a local fire station. Thank you for your service, sir.
Mark, thanks for calling.
Yes, sir. I am hearing different. What, as first responders, y'all kind of not address, what do we need to be wearing to properly protect my guys? I'm hearing different things, and my guys are asking me, what do we need to wear to protect ourselves when we go on calls to make sure that we're safe?
Great question. Director Sprayberry.
I'm going to ask Dr. Moore to address that one.
Go right ahead.
Yeah, thanks for the question. So we have, CDC has, and also North Carolina has guidance on the right type of what we call personal protective equipment that should be used by healthcare workers and for emergency responders. And we've been working with our state Office of Emergency Medical Services. You can find all of that. There's on that website that Director Sprayberry gave, ncdhhs.gov. In the coronavirus section, there's a part for healthcare providers, and there's specific information. It's providers, I should say. There's specific information for first responders. Probably on this call, best not to go into too much detail on the specifics, but it's all spelled out there, and you know, like I said, it's something that you should check back on as things change and we learn more about this virus and how it spread.
Thank you, Dr. Moore. Mark, let me also say, for Mayor Vaughn and myself here in Greensboro, thank you so much for your service. You guys are on the front line. Mayor, did you want to address that for a second?
Absolutely. You know, we know that while a lot of our office workers are telecommuting and that we've had to cut back, you know, our first responders, they are still working 24/7, as are a lot of our water resource workers and people still, you know, repairing streets and other things. But first responders, they don't get a day off no matter what's going on, and we certainly appreciate everybody's service.
We certainly do. Thank you. Julie, for another question.
Sure. We have Harvey from Sanford. Harvey has a question about, I think one of our favorite things this time of year, strawberry farms. Harvey?
Yes, thank you. We have a strawberry farm, and we are scheduled to open April 1st. There won't be 20 or 30 people at a time, but there'll be constant all day long people coming and going. And how should we respond to that to protect ourselves and also to protect the public?
Dr. Sprayberry, any information on that? We probably should have had somebody from the agricultural department on it. Any thoughts on it?
So what I would think, and this is just, you know, that's a pretty darn good question.
Yeah.
It's less than 100 people mass gathering. It's less than 50 people, which is the new guidance, I guess, that we're getting from CDC. And so my thoughts are, as long as you asked your customers to maintain good social distancing, which is 6 feet or greater, that you would be okay. Would you, Dr. Summers, would you agree with that?
Yes, I would agree. I mean, the social distance, 6 feet is good, so you keep them spread out. I mean, I would, you know, the numbers are dropping in terms of the number of people, and, you know, so less than 50 would be what I would recommend. But beyond that, I would also, if somebody is coughing, or I would ask, you know, if they've been sick, if they have fever, if they're coughing, that may be someone that doesn't need to be picking strawberries around other people. And so I would keep an eye on that also, because it just takes one person in a small area who's sneezing and coughing, and then all of a sudden you can spread it. So I would be careful about those patients with those symptoms.
No question about it. Thank you so much. Deputy Chief Emmons, another question?
Sure. We have Brent from Greensboro, a physician who has a question about something we've heard a lot about, and that is college students coming home for spring break. Brent?
Hi. Thanks for everybody participating in this. Just so you know what we're doing, we're a varicose vein practice. We have very low flow of patients, but we have enacted methods to keep patients from being apart from each other by asking them to keep their family members in the car in the parking lot, if not at all. And there are very few people waiting in our lobby, just to keep it a very small amount at all times. And that's worked very well for us so far. But my main question is this. I have a son who goes to UCLA, and last week UCLA put out a recommendation requirement that they were going to switch from classes to online classroom, but they recommended all students go home. So we went ahead and arranged to have him fly home. But now everyone is afraid that because he's flown from LAX to Atlanta, and LA has had a spike of new cases, including one confirmed case yesterday at UCLA. He is asymptomatic. He feels good. He doesn't understand why I won't let him go out and see his friends from other schools, from his high school, that they're back. What are we doing with these kids now, and how do you keep them in the house? Are we concerned that even if we do a 10 to 14 day quarantine, aren't they still potentially shedding virus?
Dr. Moore, Dr. Summers, one of you guys want to weigh into that?
Dr. Moore, you can go first, and I'll follow you.
Sure. So up to that first part, they're like I said, we're learning all the time. But in terms of the time frame between when somebody is exposed and when they get sick, that is holding pretty steady. That 14 days is really a good number to be the outside of that. So, as far as exposures he might have had there, beyond that time, it's unlikely that he'd get sick after 14 days. We do have, and everyone should be aware, specific recommendations for people who are coming back from international travel if they've been to a country that has active transmission, and right now that includes all of Europe, that they do stay home for 14 days, not go out and monitor for symptoms while they're at home. We don't have guidance for specific parts of the U.S., but I'm sure everyone's aware that there are areas, starting with Seattle, but also involving a lot of other parts of the country now, where there is widespread transmission. So we are asking people who come back from areas where they're concerned to do pretty much what you're talking about with your son, which is to stay home to the extent possible, stay away from crowds, monitor yourself for symptoms, and I think that's a good practice. I mean, everyone's aware that we're trying to increase social distancing for everyone, whether they've traveled or not, but it's especially important for people if they're coming from somewhere where there's more of this at this point in time than we have here in North Carolina. Just one other point. Well, maybe I'll leave it at that, Dr. Summers. Let you add anything.
You want to be on that? Go ahead, Dr. Summers. Did you need to add anything to that?
Well, not much. I just, that was pretty well spoken. The one thing with the students, all coming home, and in that scenario that you gave, just to reiterate the point that if anybody has any questions, if you're concerned about the symptoms that your student has that's coming from LA, be sure to have that communication with your doctor. I mean, doctors we're all busy, but we want to be able to answer those questions so that y'all are assured that you're doing the right thing. So.
Thanks. I do think he had a good suggestion about family members staying in the car and keeping the lobbies as open and as free as possible. Deputy, go ahead.
I have a doctor's appointment tomorrow, and my reminder came in to come alone. Okay. And that, if I need assistance from a family member, that's different. Otherwise, to come alone or to reschedule.
Great point, Mayor. Julie?
Sure. We have a question from Taryn. Taryn has a question about businesses and employees.
Taryn, go ahead.
Hey, good afternoon. Thank you for having this. My question is, as we talk about social distancing and we talk about the guidelines that we've been given by the CDC and then reiterated by the federal government yesterday, what are we doing to encourage businesses to send employees home? When we talk about these students and we're telling them to stay home, they're looking at their parents leave and go to work. And so I get that they're getting a mixed message, and they're like, well, I can't go out, but you're going out to work every day, and you're stuck in a business that has 400 people. What can we do to encourage to send employees home for this 10 to 14 days?
Director Sprayberry, is there any kind of protocol as far as how you guys are handling the larger, I don't know if the question was about larger employees there?
Right, sir, and thank you for that question, ma'am. So the governor is actually encouraging people that can telework to telework. And so, as you might imagine, at North Carolina Emergency Management, during times like these, we really need a good subset of our overall group of employees to be working here at the state EOC to support the operation. But I will tell you, we've really skint it back. We had to make some purchases of some additional IT gear so that I could send people home to telework, because, when you say to telework, it's not just that simple. So we had to work out some protocols. We had to work out some work assignments so that we actually have people working productively from home. There has to be some checks and balances so that supervisors know what they're getting from their employees. Right now I'm getting into some performance metrics in HR, but I will tell you that the governor has encouraged those that can to work from home to work from home. And he understands that can put a hardship on a lot of people, on a lot of businesses. I can tell you it's stretched us thin, but that's all part of flattening the curve and slowing down the spread of the virus so that not as many people catch it at one time and we don't overwhelm our healthcare resources. Thank you.
Thank
If
you.
I could add,
Okay.
I think Director Sprayberry's point, I think, is an excellent one. That measure, like we're a perfect example here. We're at work. The guidance is to stay home if you can. Not all of us can. We have people who are working in various jobs across the state who don't have that option. So our guidance for businesses also includes measures like those Director Sprayberry mentioned are being implemented here. It's not all or nothing, home or there are measures that can be taken for those that do still need to go to work to try to implement, for employers and employees, try to implement social distancing to the best extent possible while they are at work and take measures to protect themselves.
Right. Washing your hands frequently, sneezing into your elbow, coughing into your elbow, things like that. I mean, it's the common sense things that you can do to slow the spread.
Mayor Vaughn, did you add one comment there?
Yeah, we have encouraged a lot of telecommuting, and especially the people in the high-risk categories. We have told them that they really need to telecommute. So a significant part of our workforce is actually telecommuting right now. We have to keep the city open for business, but we have reduced our open-facing hours from 10 to 3 because we know that people have to come in and file plans and things of that nature. But we are doing social distancing in the office buildings, and we make sure that there's hand sanitizer all around. But for those that we know that we can get them to telecommute, they are working from 8 to 5. We make sure that they are actually being productive, but we are following the recommendations of the CDC and others to make sure that people are working, but they're doing so safely and that we're setting a good example.
Absolutely. Thank you, Mayor. We've got time maybe for a couple more questions. Deputy Chief Emmons?
Right.
Yes, we have Ms. Mary Ann from Ashboro. She has a question. She's over 65 and has a question about people over 65 who are still working.
Mary Ann?
Yes, sir. First of all, thank you all for what you're doing, and I'm just very appreciative that you all are on the front lines and you're helping us. And I just wanted to know, I've heard so much on the news about the elderly should stay home, but some I understand the elderly is 65 and up. And what about those of us who still have jobs? And actually, I'm a mail carrier in Greensboro, and I know in that job I can keep my distance pretty well out delivering the mail for the most part. But I just wanted to know about that.
Yeah, sure.
I'm happy to take that one.
Okay, go ahead, Doc.
Yeah, I was going to say that, Dr. Summers, 65-year-olds. I mean, it's not yes, the data from other countries, the elderly are more likely to have the more severe aspects of this disease. But, I certainly don't know your medical history, but if you're a mail carrier and you're moving around, you're a 65-year-old that is probably very healthy. Now, if you have serious chronic medical conditions, I would be a little bit more concerned. But from our aspect, if you're staying social distancing, you can be outside. Exercise is good. I mean, and doing your daily activities, but you just want to keep your immune system strong. That's really the takeaway from this: is do everything you can to keep your most important defense system strong. So I wouldn't say that you couldn't, be a mail carrier, but I would say, just be careful, wash your hands, keep distance, and stay active.
Good question, Deputy Chief.
Yes, we have Dwayne in Ashboro who has a question about the virus itself.
Go ahead, Dwayne.
Hi, thanks for taking my call here. I had heard early on that the COVID-19 had mutated into 2 strains. I was wondering if that is true. I'd also heard that one of the strains is more harmful than the other, and if so, which strain is currently being seen here in North Carolina? Also, have any North Carolinians currently recovered from the COVID virus?
Doctors, I'll let you guys toss it to that. Maybe both Dr. Summers and Dr. Moore could weigh in a little bit. We've got about 2 minutes left, so if we could compact those answers.
I can start real quick, and I'll shift. I'll just go real fast. Yes, there are reports of 2 different strains that are out there. I'll be very honest. I don't remember the acronyms if it's coronavirus D or L, but based on all the information that I have, while it has mutated, that there's nothing that we would do differently based on the region or the country. The fact that it's separated, there's no conclusions that we can draw from that when I talk with my ID colleagues. I'll defer the rest to Dr. Moore.
Thanks, Dr. Summers. That's correct. So there are a lot of those reports, and as Dr. Summers said, it's not a meaningful difference. This is like many viruses. Its genetic material changes a lot, but from everything we know, there's not a meaningful change in COVID-19 here versus elsewhere. So, and then to your second question, most of the cases we've had in North Carolina so far have not required hospitalization. People generally recover from those milder illnesses within a couple weeks. That would be
And let me add to that.
In the country.
Just want to add to that. Just from Wake Forest, we have not had one case in the hospital yet diagnosed. So, we're a big hospital. That gives you an example of where we are at this point.
All right, thank you, guys. I want to say thank you to Director Sprayberry. You and the governor and Ms. Stallard and the team there are doing a great job keeping us informed. Also to our doctors tonight, Dr. Moore and Dr. Summers, thank you for your medical expertise. Grateful for Mayor Vaughn stopping by, and we'll hear more from the two of us as we move forward in the days ahead. And then just a final word. We've got some additional information that's coming out. The federal government side is continuing to work on this. Just this afternoon, the USDA doing a public-private partnerships that will be providing 1 million meals to the rural population. This will be a collaborative, on a weekly collaborative basis as we handle some of this. To the faith-based ministries out there, you guys always step up. So proud to know many of you guys throughout North Carolina. We're going to need you more than ever. And depending on where you are, and not to make this too much about, I don't think you can make it too much about faith. Just remember to continue to pray for each other and to make sure that we're looking out for our neighbors. Thank you, God bless, and we look forward to seeing you in the days ahead.
Thank you, sir.
Thank you, guys. Take care. Have a good night.